evening, and thank you for joining us for tonight's informational session on tuberculosis presented by Chesapeake Health Department. At this time, I will turn the program over to Colette Doherty, who will introduce her team.
Thank you so much, Lisa. My name is Colette Doherty. I'm an epidemiologist here at the Chesapeake Health Department, and I'm joined by my colleagues, Melissa Lathrop, who is our tuberculosis nurse here at the Chesapeake Health Department, as well as our district epidemiologist, Lisa Engel. Thank you so much for joining us. We have a lot to get through tonight, so I just wanted to go over some basics. We do want this to be a Q&A style forum where your questions are answered by our panel of experts. Chat has been disabled. However, if you use the Q&A feature to submit your questions, we'll be able to answer those after we've had some information provided by Michelle Lathrop, my goodness. I will go ahead and turn it over to Michelle at this time.
My name is Michelle Lathrop. I am the tuberculosis nurse for the Chesapeake Health Department, and we're providing an information session on tuberculosis for the Oscar Smith High School contact investigation. If you want to do next slide. So the agenda for this evening, so why are we here tonight? What is tuberculosis or TB? How does TB spread? Latent TB infection, which is also called LTBI, versus TB disease, TB risk factors, TB testing, treatment, and what should you expect next? Next slide. So why are we here tonight? Next slide. What is TB? So why are we here tonight? We are here tonight because some students and staff at Oscar Smith High School have been exposed to someone with active TB disease. We want to inform you, provide information about TB, and share some information about what you should expect next, as our concern is for your health and the health of our community. What is TB? Next slide. So tuberculosis is spread from person to person through the air. You do have to be around somebody for a significant period of time, repetitively in a fairly small area. TB disease is caused by a bacteria, not a virus, but a bacteria called Mycobacterium tuberculosis. The bacteria, or sometimes referred to as TB germs, usually attack the lungs. However, the TB germs can attack any part of the body, such as the kidney, spine, or the brain, but it does always start in the lungs because it is an airborne bacteria. It can take 8 to 10 weeks after being exposed or around somebody for someone's test to actually be positive. That we call that the incubation period, and I will refer to this incubation period later in the presentation. Not everybody that is infected with TB germs does become sick. A key takeaway here, it's not listed on the slide, but I always like to mention it, that everybody's familiar with COVID virus and we were wiping everything down. TB bacteria is not a virus, it's a bacteria, so it dies very soon as it hits an inanimate object such as a table or clothing, even food or liquid. It can only survive while floating in the air. Next slide. So how TB spreads. Next slide. So you'll see a picture here. The picture shows how TB germs spread through the air. The TB germs are put into the air when somebody with TB disease of the lungs or throat coughs, speaks, or sings. And in this example, this is the person on the left. People nearby may breathe in these germs and become infected, which is the person on the right. The person on the left has TB disease and is putting the TB germs out into the air. The person on the right is breathing in the TB germs into their lungs. But just as I stated, when the bacteria comes in contact with anything other than the air, it does die. The best way that we can stop the spread of TB is to identify those people that have active disease. We isolate them, especially if they are contagious, and we provide treatment as soon as possible. People with TB active disease are most likely to spread it to people that they're going to spend a fair amount of time with every day. And that would include people, family members, friends, coworkers, and schoolmates. Next slide. So the way the TB is not spread is you can't get it by sharing your toothbrush with somebody, saliva from kissing, shaking hands with somebody, touching bed linens or toilet seats, sharing food, drink, or utensils. Again, once it hits any of these objects, the bacteria does die. Next slide. So latent TB infection versus and TB disease. Next slide. So not everyone that's going to be exposed to TB germs is going to get infected. And not everyone who gets infected with TB germs is even going to become sick. So because of that, we have two different conditions that exist. We have latent TB infection, LTBI. You are not sick. That means that you do not have symptoms. You cannot spread the TB germs. And these people can actually carry this bacteria, these germs for years, may not ever even know that they have it. On the other hand, TB disease, that is where the infection, the bacteria, or the germs have multiplied. As you can see in the little picture, the first picture of the lungs just has a few little TB bacteria. The picture on the bottom is somebody with active TB disease. The bacteria is multiplied, and these people are sick, and they are contagious. And again, this is why we were here, because we want to make sure that nobody has become infected. Next slide. Again, just another example of the difference between infection and disease. On the left, again, the lungs just have a small amount of bacteria. This is latent TB infection. And the lungs on the right have a lot of bacteria. This is active disease. Both of these people are going to have a positive blood test or skin test, because it's just going to detect the fact that, yes, this person has bacteria in their body. What we have to determine when we get a positive blood or skin test is determine, does the person just have infection or do they have active disease? Somebody with infection, they're not going to have any symptoms again. They're not going to be sick. Their chest x-ray will be normal. They can't give it to anybody. On the other hand, somebody with active disease that has lots of bacteria is going to most likely have symptoms such as a cough, fever, night sweats, poor appetite. This person is most likely contagious, not always, but can be contagious. And their chest x-ray will most likely be abnormal. Go ahead and switch slides. Next slide. So this flyer should have been sent out to you with your email or letter. And like the previous slide, it explains the difference between latent TB infection and active TB disease. So as you can see, the latent TB infection shows that the bacteria or the germs are sleeping. This person's immune system is keeping it from making more. The person will have a positive skin or blood test, but they will not be sick. They can't spread it to anybody. They'll have a normal chest x-ray. But what we like to do is we like to treat somebody that has sleeping bacteria or infection so that they do not become the person on the right. The person on the right is somebody who has had the infection, possibly didn't even know they had it, so they didn't seek treatment. And their immune system broke down, and now the bacteria wake up, they make friends, they multiply, and now that person has active TB disease. Somebody with active TB disease is usually, again, displaying some signs and symptoms of a cough, fever, night sweats, poor appetite, excessive fatigue. Their chest x-ray is most likely abnormal. They're contagious. And this person definitely has to have treatment because they are a public health concern. They are contagious to the general public. Next slide. So testing TB or latent before you get sick with the actual disease. So again, if your immune system can't stop the TB germs from growing, they're going to become active and they're going to multiply in your body, and it's going to change from infection to disease. Most people diagnosed with TB disease in the United States become sick after living with it for years. And again, may never have even been tested, so they never even knew they had to seek treatment for the infection. It is estimated, believe it or not, that there are at least 13 million people in the United States that have this latent TB infection. Latent TB infection treatment is 90% effective in preventing the development of active TB disease. Next slide. This is some possible TB symptoms, TB disease symptoms. Again, like I said, night sweats. And when I say night sweats, not just waking up kind of perspiring. This is really just soaking up your sheets. You are really sweating up a storm. Fever, chills, weakness or fatigue, and not just generalized fatigue like we kind of experience on a day-to-day basis. This is excessive fatigue, like you cannot get out of bed. The next one, weight loss. And again, not just a few pounds. This is several pounds over a very short period of time. No appetite, a cough that will last. It'll be ongoing. It will progress. You'll start possibly coughing up some sputum and maybe even blood within your sputum, and then some chest pain. Next slide. So people with TB disease are sick and they can spread the TB germs. So it is a serious condition. You actually can die if you are not treated with the TB disease, or you can die if you have TB disease and you do not seek treatment. And that's because the bacteria are just going to continue to multiply, and it basically eats away at the lining of your lung. So you have to have treatment for TB disease. It can be cured. It's years ago, we didn't have medications for disease. Now we do. It is treatable and curable. A person with TB disease is going to need some chest x-rays, further lab tests. They're going to take a minimum of 6 months or 180 days of medicine, sometimes more, and then follow up, of course, with the close contacts like we're doing here today, following up with people that may have been exposed to a person with active TB disease. Next slide. So public health workers like myself are responsible for finding TB contacts. A TB contact is a person who has been exposed to somebody with contagious TB disease. Again, contacts are going to include the family members, roommates or housemates, close friends, co-workers, classmates, and others. People with TB disease can spread TB germs to those around them, as I've stated. The health department is going to contact a contact investigation, which again is what we're doing here, by following up with and testing those who have been exposed or close to somebody with active TB disease. Next slide. So what are some risk factors? Who is higher risk for becoming infected with TB germs? Well, as I've stated, anybody can get TB. Again, it's airborne. So we all move about our days here and there. So anybody can get TB, but some of the things that can put somebody at higher risk of getting infected is somebody who, has been around somebody with infectious TB. Also people who are born or spend time in countries where TB disease is more common, so places as Mexico, the Philippines, Vietnam, and India. Healthcare workers and others who work in places are at higher risk for TB transmission, such as homeless shelters, jails, or nursing homes. Those are like congregate settings, and those can place people at higher risk for getting TB, being infected with TB. Next slide. TB testing. So there are two types of tests that can be used to diagnose TB infection or latent TB, LTBI. There's the blood test or a skin test. We are going to be providing a blood test for the purposes of this contact investigation. It is a little more specific. It's also nice because it's just a one-time meeting with us, whereas the skin test, it's a minimum of 2. So for this purposes of the contact investigation, we will be doing the TB blood test. If it is positive, there will be further tests, which would include medical examination and a chest x-ray. Next slide. So the TB blood test. So blood will be drawn and it's going to be sent to the lab for testing. A positive blood test, it would indicate that the person likely has been infected with TB germs. And so when we do get a positive test, the next thing we're going to do, we're going to ask some more questions, but we're also going to send you for a chest x-ray. A negative blood test is a person's blood did not react to the test. So a blood test did not react to the test, and latent TB infection or TB disease is not present, or it's still in that incubation phase, which I had mentioned earlier on in the slideshow, which was that TB bacteria is what we call a slow growing organism. It takes a very long time for it to finally say, hey, I'm here. So that's about 8 to 10 weeks. We have started this contact investigation quite early from identifying the person. And so we are in that 8 to 10 weeks, and we're not outside of it yet. So we're testing everybody now. And those people that are negative, we are going to want to retest you outside of that 8 to 10 week time frame just to make sure you do not come back positive. That's going to occur in mid-January of next year. So hopefully we'll get through this phase, and then we go into January, it'll be no problem. Everybody will know exactly what to do. So next slide. So I know some individuals that come from other countries where TB is more common. They do have a vaccine called BCG, Bacille Gament Giron. Those are the scientists that developed the vaccine. It is a vaccine for TB disease, and it is given to infants and small children in those countries where TB is more common. We do not administer the BCG here in the United States. Next slide. So TB blood tests, which again is what we're doing for these testing events that we're going to have, is preferred for people who have received BCG. The TB vaccine BCG may take a TB skin may make a TB skin test harder to interpret. The TB vaccine does not always affect the TB vaccine does not affect a TB blood test result. And TB blood tests give more of an accurate result in people who've received the TB vaccine. So I know that people coming from countries where they've received it, they always know, or they say, I should not receive a skin test. It could possibly cause a false positive on a skin test. Well, that's why we'd like the blood test. The blood test is not affected by the BCG vaccine. So we do get true positives. Next slide. Treatment. So treatment for LTBI or latent TB infection, it can prevent the development of TB disease. So again, TB germs in the body of someone with latent TB infection are inactive. They're laying there sleeping, and they're not going to be sick. But they can multiply, and they can make somebody sick with active TB. So people with latent TB infection, so when we do these tests, if somebody comes back with a positive test, meaning they have latent TB infection, it is highly encouraged that you take medicine to prevent you from getting active disease later in life. Next slide. So treating latent TB infection, it is effective in preventing TB disease, and there are several options for treatment of latent TB infection. There have been advances in shortening the length of latent TB infection treatment. The traditional 6 to 9 months that everybody's probably familiar with a medicine called isoniazid or INH. We still have that treatment regimen, but they have come up with shorter regimens as short as 3 to 4 months. The short course latent TB infection treatments are effective, they're safe, they have a higher completion rate than the longer treatments, so it does help people finish their regimen completely. Next slide. So what to expect next? So now that you've been provided with this information about TB, here's the information about the testing dates and the sites for next week, which were also listed on the letter that was sent. There was a link on the letter to register through something called REDCap. You can, and you believe you can even scan the QR code here on this slideshow. And that's going to take you to a link to register. You'll enter in your demographic information, answer some questions, and get you registered electronically. And then once that happens, we will call you and set up your testing date and time. If you are unable to register electronically, no worries, please still come to one of our testing days and times, and you can do it, the old-fashioned paper way. We will still get you tested. It is very important that we get everybody tested, and you'll see Oscar Smith High School, that's where we're going to have our first testing day, Tuesday, November 14th. That's next Tuesday from 4:30 to 7:30. It's going to be held in the cafeteria. And then we're also going to hold another testing day at the Chesapeake Health Department. That would be Wednesday, November 15th from 2 to 6 p.m. Please note if the child is under 18, you will need to be present with them. If you're worried about coming because you think there people will be showing up with symptoms, we are trying to put a stop to that. In the red cap registration, it's going to ask, is the person symptomatic? And if that is the case, we will call you separately and set up a separate appointment to be seen here at the Chesapeake Health Department. If somebody comes as a walk-in to one of the sites, they're going to be met with people registering up front. And if they're indicated to have some symptoms, we will ask them to please return home, and we'll set up a different day and time for testing and assessing. Next slide. So before the testing event, there was a phone number for a call center that was also on the letter. We have received some calls, appreciate that. It is still open. If you don't reach somebody, please leave a voicemail and we will get back with you to answer any questions you may have. If your child was identified as being exposed, and so you are nervous, can my child be around other children, other household members? You do not need to keep people separated in the household unless there are signs or symptoms of active TB, which I discussed. And if that's the case, please contact us here at the health department or your local provider for further information on what to do from that point. Next slide. So during the testing event, registration will be completed, as I stated. If not electronically, we'll do it in person there. After you're registered, we're going to do that in the auditorium. After registration, you will then go in and be assessed. You'll be asked a bunch of questions, risk assessment questions. And then after you have finished the assessment portion, you will go on to the next stage, which will be to have your blood drawn. Next slide. So after the testing event, the results usually are available within 5 to 7 business days. If it is positive, you will receive a phone call from us. If it is negative, you will receive a letter in the mail, which may actually take a little longer than 5 to 7 days. So if you do not receive either, please contact us so we can get that information to you. If the result is positive for TB infection for you, for a staff member or student that we're testing, you will need a chest x-ray. The health department, we will coordinate that with you, and it is free of charge. If LTBI is diagnosed, meaning the blood test is positive, chest x-ray is negative, or within normal limits, we will offer treatment through our health department. The health department is concerned about you and your child, and if there is any kind of active disease that we think may be there, we will also do additional testing. Next slide. So now we're going to go to questions. And there's the contact information as far as the hotline.
All righty. Thank you so much, Michelle. We'll go ahead and jump into the question and answer session. We have a couple of questions here. The first one being, if I or my student didn't get a letter, do I still need to seek testing?
Let me see. Am I still unmuted? Okay. So if you did not receive a specific letter stating that you were part of the group of people that are considered part of the contact investigation, no, you do not need to seek testing at this time.
Thank you. The next question is, do I have to go through the health department for testing if I was notified?
You do not. We prefer that you do, just so that we can have a better understanding of the big picture of everybody, not to mention the fact that it is free of charge if you come through the health department. The other big aspect or reason I say I would prefer health department is a lot of physicians' offices may not be able to accommodate you, especially for the blood test. They may be able to send you to LabCorp, but they may not understand exactly what testing needs to be done.
Thank you. Okay, we have another question for Michelle. When I show up for a lab draw, what should I expect?
So first of all, you do not have to be fasting. A lot of people think you have to be fasting for any kind of blood draw. You do not. It's going to be just one vial of blood. We will have cots if you prefer to lie down. And please let us know in advance if you're somebody that kind of gets a little woozy. We'd rather you tell us beforehand so we can lie you down. And we will have snacks, but please do eat before you come. We will also have the Chesapeake Fire Department EMS is going to be present for any unusual circumstances that may arise, that we may not think that's going to happen. So that would be it.
Thank you. All righty then. And is it still safe for my child to attend school and activities like sports or choir?
Yes, it sure is. Unless, like I said, if you're symptomatic, and I know it's flu season and it's, people still having COVID and RSV and stuff. So it's difficult to determine, well, he has a cough, but I mean, it has to be a significant cough for at least 3 weeks. We're talking fever, weight loss, night sweats. Those are all symptoms of active TB. And again, it's a slow grower. And so the people that we've notified in this group have not been around that individual for that long, for the person to be infected and go to disease that quickly. So if there's a slight cough or a fever, it is most likely a cold. So they are, and especially if they have no symptoms, they definitely can be participating in all school activities.
Excellent. Thank you. Those are all the questions that I have for now. Would we like to go ahead and give folks a minute to enter any final questions before we shift away?
Sounds good.
If anyone in the audience has any questions at this time, please go ahead and type them in the Q&A box, and we will direct them to the appropriate member of our panel.
Did we have any in the chat? Oh, no, we didn't. Okay. That's right. You turned that off.
Yep, they have to be typed in the Q&A box.
Okay, perfect.
All righty.
We're good.
I'm hearing none, seeing none.
Okay.
If anyone has any questions or concerns, they are more than welcome to call the Chesapeake Health Department and our TB line that was included in the letter. We have that staffed Monday through Friday with the exception of state holidays from 8:30 a.m. to 4:30 p.m. And even if you don't get a hold of somebody, if they're on the line with another customer and you get the voicemail, if you leave a message, it will be returned by the end of the business day. Alrighty, at this time, I think we'll go ahead and turn it back over to Chesapeake Public Schools staff. And thank you so much for having us.
Yes, thank you, ladies. At this time, we will conclude our presentation. We will have this on our Chesapeake Public Schools YouTube channel, and the health department will also have a link should individuals need the webinar again. At this time, I'd like to wish everyone a good night and thank you. And remember, families and communities work better together. Have a great evening.